Association of India, Nagaland branch. We are an NGO that has been working on sexual reproductive health for the past 75 years. And our core programs are basically family planning, as the name suggests, and sexual reproductive health issues. The idea of this media meet is basically to sensitize the media fraternity on sexual reproductive health in emergencies. We have one-pager statements only, so we will not take much time. So, why are we calling for a media meet? In Nagaland, we have not had so much of a problem or humanitarian crisis that we had to keep things in order. So it is only in times of landslides or mock drills on earthquakes. So those are the activities that we have been basically doing when it comes to disaster or humanitarian issues. We are all aware our neighbor Manipur state has gone through problems, and we, as Family Planning Association of India, we conducted 29 health camps in Manipur state as a humanitarian response to the violence affected people. We have visited 29 relief centers, and we were able to reach out to 3,000 plus people with sexual reproductive health issues or medical services. And keeping this experience in mind, Northeast has a protracted humanitarian crisis facing us, and so we have to be prepared. And FPA India Nagaland branch is the only branch present in the Northeast here in Nagaland, Kohima. And so we have been selected, we have been assigned, trained to be prepared for any emergencies. And this is where our mandate goes: sexual reproductive health in emergencies. I will read out the things that I've written that will be faster. Family Planning Association of India, which has been working on sexual reproductive health for the last 75 years, has launched the Spring 4 project, which focuses on preventing sexual and reproductive health to prevent morbidity, mortality, and disability in crisis-affected population. Over 110 million people have been forced to flee their homes, driven by three interconnected realities: violent conflict, climate change, and extreme poverty. Almost half of these are children. We're living through the greatest displacement crisis recorded in history. During conflict, natural disasters, and public health emergencies, sexual and reproductive health needs are often overlooked, with staggering consequences. Pregnant women risk life-threatening complications without access to delivery and emergency obstetric care services. Women and girls may lose access to family planning services, exposing them to unintended pregnancy in perilous conditions. Women and girls also become more vulnerable to sexual violence, exploitation, and HIV infection. During times of emergencies and crisis, people are evacuated to relief centers or neighboring communities or villages. The effect of emergencies differs from community to community. In such situation, protection mechanisms and service delivery breaks down. Sexual reproductive health services are essential and will have to be continued. FPA India, with its minimum initial service package, we call it MISP, ensures that clusters are identified through organizations to lead MISP implementation. This preparedness for MISP through training of humanitarian, this preparedness of MISP through training of humanitarian personnel in collaboration with volunteers, partner organizations, district-level disaster management and health service delivery systems. Pre-preparedness is to bring all stakeholders together for collaboration and ready to respond to emergencies. FPA India Nagaland branch is among 12 branches across FPAI network selected for implementation and training and advocacy that will respond within 72 hours where normal functioning and machinery needs supportive action. The MISP, that is long term, which we call it minimum initial service package. This is a very important service package for FPA India. The minimum initial service package is set of life-saving activities to be implemented at the onset of every humanitarian crisis. It is an internationally accepted minimum standard of care for reproductive health, pioneered and rolled out by International Planned Parenthood Federation. The sexual and reproductive health services set out in the MISP can mean the difference between life and death for people affected by disaster. What is minimum initial service package? We call it 6+. 6+. 1. Ensure health cluster identifies an organization to lead the MISP for SRH. That is 1. 2. Prevent sexual violence and response to the needs of survivors. 3. Prevent morbidity, mortality due to HIV and STIs. 4. Prevent excess maternal and newborn morbidity and mortality. 5th, prevent unintended pregnancies. 6. Plan for comprehensive SRH services integrated into primary health care and as soon as possible. And 6+, we call it 6+. It's not 7, but 6+. Ensure that safe abortion care is available to the full extent of the law in health center and hospitals. We have 6 MISP plus, and the plus is ensure that safe abortion care is available to the full extent of the law in health centers and in hospitals. So why are we talking about MISP? Why are we talking about sexual reproductive health in emergencies? This is all because time is coming. Before it comes, we should be prepared. We should let the policy makers, we should let the people at the helm of affairs understand the need for services, focused services on sexual reproductive health, even in emergencies. In emergencies, in humanitarian settings, in disaster settings, crisis settings, what we normally look at is safety, food, shelter. Safety, food, shelter. But we overlook very important factors of sexual reproductive health needs of people of affected population. And that is why Family Planning Association of India, under SPRING project. SPRING project is being funded by what used to be formerly known as AUSAID, 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 but it is now DFAT, DFAT, rename. And so our agenda for calling the media people to kindly come and have this media meet is to talk about the works that we do, and also to let you know of our intention to start campaigning, not for the ULB election yet, but to start campaigning for inclusion of sexual reproductive health services in emergencies. So we need to collaborate with Disaster Management Authority, we need to collaborate with civil societies, we need to collaborate with youth, we need to collaborate with health department, we need to collaborate with media, so that we are able to jointly put our agenda, advocate for inclusion of sexual reproductive health in emergencies. That is all that I wanted to present. I thought I'll take very little time, but I think I took more time. But we have one pager. We have a global fund project going on. And since we are meeting you like this, we thought it would be very good for us to also, apart from SPRING project that we are advocating today, we also would like to, share with you of the Global Fund project activities and programs that we have. And Puna Songla, our counselor, will read out her statement.
The objectives of Global Fund project are to strengthen pathways to social protection, increase awareness, rights and opportunities, advocacy for change, and to provide integrated health clinic and specialist clinical services, and also to provide CAC sessions to young DLHIVs and services for aging DLHIVs. The key population under Global Fund are DLHIVs, ITUs, MSN, FSW, transgender, non-binary or bisexual, and partners of cases or high-risk groups. But at the moment, Nagaland branch are focusing on two key populations, that is the PLHIVs and ITUs. Under the Global Fund project, we also have doctor services. We have a medical officer that comes to our clinic every Tuesday and Friday of every month from 1 to 5 p.m. And we also have a specialist services, that is a secretary. He visits our clinic every third and fourth Thursday, 2 to 5 in the evening. A physician who visits our clinic second and fourth Saturday monthly, 10 to 12 noon. And we also have an obstetrics and gynecologist appointment. And besides this, we also provide counseling services like ART adherence and psychosocial support, and also lab services like hepatitis, HIV, and STI testing and screening. And we also have more monthly programs in their GF. Those are 2 CAC sessions with young PLHIVs and outreach health services and support group meetings. That is a short update summary on the Global Fund project. Thank you.
Our clinic is in Darkland, just opposite to Charity School, and if you want to enter from the main town, then you can enter through the gully beside the United Traders shop. So in that gully, if you walk in between the gully between the क्या बोलते हैं, United Traders and SABT complex. So if you walk in that gully, you will come straight to our clinic. Our clinic is not flashy and glamorous, but it is a clinic where you can come and feel at home. Walk in from the main town and walk out from Darkland. So when it comes to confidentiality, privacy, it's perfect. And we also have, we don't have a ward system, but we have bed where clients can come in, and if they're tired, they can relax. Lie down, relax, and move on. This was basically initiated because of some of the clients we used to have previously, PLHIV clients who were having history of drug use as well. So when they walk from PR Hill down to our clinic, they get very tired. So I can aram kuriwo, and whatever abscess dressing han ki han thaile ibang kuriwo, doctor nurse gets do side what, then they move on. So it used to be like that. So the bed is still there, anybody who walks in. And just below in the one pager, we have written very boldly, we follow a no service refusal policy. So any client, we don't call people patients, any client who walks into our clinic and says, I don't have money, but I want this service, the available service will be given free of cost as part of our no service refusal policy. If we don't have the service, can't help. But whatever service we have, and the client says, I don't have money, we can't let the client go back without service. It will be given. Our doctor from Tuesday to Friday, Tuesday on to Friday, comes at 5 p.m. So he is available, very committed, punctual, and he is available. Specialist doctors, they come on, their specific days. So we have psychiatry, doctor who comes and take care of particularly people, not necessarily, having a mental issue, but having emotional, psychological issues. Psychiatry doctor, very good, he takes care of that. And then we have physician coming in, and then we have obs and gynae on appointment. They can come in and take services. If you have gone through, you must have come across CSE in the monthly program. CSE is a short form of that one pager. CSE is a short form of Comprehensive Sexuality Education. In this, we have 7 modules, and we go to schools and colleges. We conduct adolescent education. We call it adolescent education, synonymously called adolescent bikwe or CSE bikwe. But it is a curriculum that is developed by International Planned Parenthood Federation, time tested, and we go to schools and colleges. According to ages, we conduct sessions with them. So we're talking sometime on gender, we're sometimes talking about sexual reproductive health, we're talking about relationship, we're talking about HIV, STI, all those things. So CSE, Comprehensive Sexuality Education. That's our core program. And in Global Fund project, we are incorporating that core program as well, so that the key population, children from key population also get educated. That's the part, CSE. As an NGO, we have so many of abbreviations. So sometimes it gets daunting as well. Here, key population, we are talking about under Global Fund. GF is Global Fund. Global Fund is the international donor. Plan India is the principal recipient, and FPA India is a sub-recipient of that fund. PLHIV, people living with HIV, IDUs, intravenous drug users, MSM, men who have sex with men, FXW, female sex workers, transgender, non-binary, bisexual, partners of KP. KP means key population, and HRG, high-risk groups. Our SRH, small letter IE, into the sexual reproductive health in emergencies. We hope to get more free time so that we can sit down together and discuss further on how we can handle issues with regard to sexual reproductive health in emergencies, because it's going to come, and if it comes, it's going to be protracted crisis for us people in the Northeast. Manipur, we thought it came and it will go, but it's not happening like that. It's gone on for a year. Now you have the climate change effects happening in Manipur as well. So we should be prepared. And it is our women, our girls, our young people who need to really understand, who we have to really take care of.